Okay, so we've talked about low back pain from facets, low back pain from discs, low back pain from the sinovertebral nerve, and now I want to talk about low back pain related to compression fractures or broken bone in your back. So these bones can break. Not very common in younger people, but as we age, we develop osteoporosis. That's a weakening of the bone, and when the bones become weak, they're more prone to break. One of the bones that's very common to break in patients with osteoporosis are the vertebra or the bones in our spine. These bones break usually from a low impact injury, something like a slip out of bed, or I had one patient tell me they were in a transportation bus and hit a speed bump aggressively and then felt immediate pain in their low back. And that's how they developed it. It was just from hitting a speed bump, which most of the time does not cause a broken bone. The pain is isolated to the low back, does not radiate down the legs, and is almost exclusively in older patients and much more common in women than men. The treatment for it is very simple. Well, first of all, the diagnosis for it is getting an MRI. An MRI will help to identify what level is broken and how many areas are affected as well. The treatment for it is very simple. It's actually using a specialized needle to go into the bone and inject cement into the bone to stabilize the fracture. The pain relief from this procedure is pretty immediate. Patients tend to report pain relief within a few minutes after the procedure, but the majority of them report pain relief by the next day or two. It is an outpatient procedure. We do it in our clinic. We provide patients with just a little bit of sedation, but they don't need a general anesthesia. They don't need to be in the operating room, which they like because then they can go home the same day right after the procedure. The procedure takes, as long as most clinic visits do, and is very simple to do, something that is actually one of my more favorite procedures to do because the pain improvement is so significant afterwards. Patients that are suffering with low back pain as a result of a compression fracture really are ideal candidates for an interventional pain physician to sort of do his work. If you're suffering from low back pain as a result of a low impact injury and you think it could be related to a compression fracture, first step is to be seen by a pain physician. We'll get some imaging to determine it and then get it addressed very quickly. So there's no reason to be suffering from this. Something to think about. Don't just think that because you have low back pain after a little fall that you don't have something more serious that needs to be evaluated. A little fall can cause a big problem, and it's important that you're getting it checked up on appropriately. So again, lumbar compression fracture, treatment for it is cement injection or a kyphoplasty, and very simple outpatient procedure that provides tremendous pain relief.